Hi, my name is Michael. My partner is Dakota, and then we're going to be talking about the topic of digitalized medicine. By digitalized medicine, we mean electronic healthcare records that are taken by doctors, nurses, basically any healthcare professional during an evaluation or like a doctor's visit. We kind of thought this was an important topic to bring up because digital medical records are going to become a big thing in the future. So we believe that if it's kind of brought up now, we can kind of bring some attention to it. And another reason we want to talk about it is because, like we said, they are going to become a bigger thing in the future. So it is going to be a topic that comes up when you're talking about patient and doctor interaction. So, as healthcare professionals, we do see both the positive and negative effects of electronic medical records or EMRs. So, some positive effects that we see is that it is a lot easier for healthcare professionals to coordinate when it comes to a care plan or rehabilitation of a patient. It does allow that process to be a lot more streamlined and easy. We also see that the input of information as well as the withdrawal of it is a lot quicker and faster because everything is in one centralized database. On the other hand, the negative effects is that it does pull from patient attention, so we can't necessarily give them as much hands-on or eye contact or anything like that. It's a lot harder to create that, as well as it is harder to split the attention between both the patient and inputting the information. That can lead to like faults in the information or just maybe a misunderstanding between what they're saying and what we're writing.
Because we see how the EMR impacted our interactions within the athletic training room, we wanted to see if these positives and negatives were similar among doctor-patient interaction as well. To evaluate the impact on these interactions, we interviewed two doctors that work both with general population and student health, as well as athletes in the athletic department. We chose Dr. Radakovich and Dr. Henry because of the age difference to see if there's any difference in opinion on digitalization. We also interviewed a nurse to get a different perspective from within healthcare system. And finally, we created a patient survey to evaluate how patients feel digitization has affected their treatment. We've compiled the evidence we've gathered from these means as well as peer-interviewed journals to give you a comprehensive view of digitalized medicine.
We did ask Dr. Henry and Dr. Radakovich if they thought technological advances had improved or changed their practice. They both said yes. They both thought that the lines of communication between both healthcare professionals and patients were improved, which allowed decrease in time to be able to get a plan together to help treat the patient. Dr. Henry also mentioned that she thought not only between healthcare professionals and patients, but between a doctor or a doctor and a nurse, that the communication was a lot easier. So it did decrease time to, once again, be able to kind of come up with a plan between doctors if, it's just a general doctor and maybe a specialist, to be able to communicate what's really going on with the patient and put a plan of action together to make them better. We also did ask a nurse about what they thought about this, and she said that she did think it was a lot easier to be able to communicate bedside with a patient. However, sometimes it did cause stress between coworkers because it could prove to be very distracting. So on the other side, we did find a study that didn't quite fit this idea, and Hassel et al. Found that out of a study of 4,000 patients, they basically saw that the patients were more accepting of new healthcare methods, as far as EMRs and communication methods, whereas doctors weren't, which doesn't follow what Dr. Henry and Dr. Radakovich said, but they did cite in the study that a decrease in communication of physical communication, not just through the computer or through email, they found that personal communication was the reason why the doctors disapproved.
When we asked the doctors if the EMR have influenced or changed the time it takes them to document appointments, they both agreed that EMRs have had an effect. But the skills possessed by the individual doctor determine whether it takes more or less time, whether or not you're good at navigating a computer and the program you have, as well as typing abilities, can hasten or hinder the documentation process. Both doctors mentioned that learning new systems takes time and is slow at first, but as you get more comfortable with the time it takes to dictate an appointment decreases. Here we will see what Dr. Henry has to say about the EMRs at WSU.
Our EMR is very user-friendly, but the other thing is a chart is a chart is a chart, from a standpoint of a paper chart. Mm-hmm. But each time you change a medical practice, you might learn a new EHR. You know what I mean? And so then that's so when I change jobs, I had to learn, and I've been very lucky. I think the two I've used are very intuitive. A very good friend of mine, theirs is awful. Yeah. She spends way more time documenting due to the way hers is set up. And, so it also, a lot of the EHRs make us the data inputters, and there's not a lot of way to change that, which just takes a lot of time, and it's not like we get, not that we need to be compensated for everything, but it's a time thing. It's really,
Dr. Radakovich agrees with what Dr. Henry has said, but he also brings up a valid point in consideration of time.
It takes longer, but the advantages are that we don't have to duplicate a lot of work. So when I'm writing a prescription, it's there. I don't really need to go through and elaborate in my note because I've already written the prescription. There's a record.
It's already on the computer.
When I order an X-ray, it's already there and it's dictated. Yeah. So there's a lot of efficiencies that go with it. But in general, I do spend more time documenting than I did before. But part of that also too is times have changed in the amount of things that have to be documented, not just medical legally, but also in terms of justifying, I think, for reimbursement to document what the work you did to say, it is legitimate for me to charge this. Well, that's not an issue here at Health and Wellness because we don't do that, but in private practices, that's an issue for people.
Next, we asked them how they believe patient interaction was affected by technology. Both kind of gave some interesting answers. They both believe that it was a two-way street and that technology that they found it was used a lot more on the patient side by younger generations, whether it be by texting or talking on the phone, and the doctors themselves felt like that was a little bit of a distraction because then they couldn't provide the quality care necessary. Dr. Radakovich did say he thought that it was a lot more challenging within the younger generations, but also that he felt that technology on the doctor's side was a lot more of a hurdle to jump with the older generations because they're used to more face-to-face interaction. And Dr. Henry did say that she wasn't able to observe like is necessary, and she found that kind of decreased the quality of care of what she felt like she could give to the patient. The nurse we did talk to also did find that technology was an influence on the patient care that she can provide. She found that the biggest problem was when she was in rooms that she ended up spending more time on the computer than she did with the patient, and it wasn't necessarily a problem with the patient as it was with the family because they didn't feel that the individual was getting the quality of care that they probably deserved. So she found that to be a consistent issue within technology. Also, we found a quote from Weiner et al. That I'm going to kind of summarize up, but basically what they said is that IT should be used to improve patient care, not take away and basically be used as a crutch for empathy and compassion and being able to have face-to-face interactions with the patients.
When we asked the doctors about their opinions on the ease of patient contact, they both agreed that there are positives and negatives. Being able to communicate easily with other healthcare providers in a critical time situation is a large benefit. Both doctors mentioned the hassle of pagers being a hindrance on communication and patient care. But the broad array of communication styles can be difficult to keep up with as well.
Patience, yeah, not so much patience on the cell phone. But I email them, or it's actually called secure messaging, because it's from within the chart. So then I log in on my side, you log in on your side, and then that's it. So and you can do it from within the EMR. I love that. Mainly because I feel like I can take better care of my patients. They can access me if they're having trouble making an appointment or something. And sometimes they don't want to ask the front desk or whatever, so I email folks all the time. And for whatever reason, I don't mind the time in that. That's not something I can bill for at this point or whatever, but I feel like it allows me to take really good care of my patients, and I'm really accessible without imposing too much on me.
How do you feel about the ease of your patients being able to contact you due to technological advancements, and is this something that is a benefit or a burden to you?
I think in general it's a benefit. I think the big struggle, or why it's a benefit, is just that if we go back to the system where it was either a phone call or it was nothing, that you can imagine that it can be difficult and to reach someone. Say they have a critical test result that comes back and you need to notify them, and they don't happen to be by a phone, and they're off in a lab, and they're going to be there till 1 a.m. or something like that. That it's so much easier to be able to communicate with someone, or establish before they even leave the room, to say, I'm ordering these tests. How do you want me to get these results to you? To find out, is it a cell phone? Is it their home phone? Is it a secure email? Whatever it may be, and that can makes things easier. The struggle is just that, again, there are more things for me to have to kind of survey and keep on top of, between regular email, secure email, texting, phone messages, my desk phone, on down the line. Wow. So there's just more things that I just have to make sure that I'm constantly checking throughout the day, and that part makes it a little bit harder. But on the other hand, too, that if you've kind of established the ground rules with people, and you know this particular person, this is how we're going to communicate, it works out okay. And again, don't have to be in the office to do it. You can do it remotely, and
with your phone.
Either with the phone or remoting into my desktop, so that most of the time those things are much more simple than they used to be.
Okay.
Dr. Henry and Dr. Radakovich looked at the next question from very different angles. When asked if technological advances have influenced the treatment of patients, Dr. Henry focused on the EMR aspects of medicine, and Dr. Radakovich discussed actual treatments. Dr. Henry highlighted that having test results, previous treatments, and medications right there in the EMR makes it easier to see the progression and help make a logical decision of what steps should come next in treatment. It is also easier to look up information quickly with the computer and the patient right there in the same room at the same time. Let's take a look at what Dr. Radakovich has to say.
Have technological advances influenced the treatment of your patients? If so, how?
In terms of just thinking how things have changed, again, MRI was kind of experimental. Essentially, when I started off, CT scan was used, but not even as frequently as it's now. But even going back to all the types of procedures, absolutely no question. I mean, people read the paper and see that Heinz Ward had PRP before, and then pretty soon they'll Google it, and then within a week you have people coming in, not to mention that what he got, in no way or shape or form could have actually helped him get ready to play the Super Bowl, but they don't know that, and so people are demanding that. Or people come in, have had knee pain for a week without any real disability, and feel that they need an MRI, they need a $2,500 test, when in no way, shape, or form, even if they had an abnormality in a meniscus, are they going to get a surgery without trying some other things first? But it certainly, patients certainly have expectations, whether they're realistic or not, that because it's available and my insurance will cover it, so why don't you order it for me?
Yeah.
Type of an attitude, which it has some problems.
Even with the advancements in imaging, Dr. Radakovich points out that technology is not all-knowing.
I think there's a lot of blind faith that technology can tell us everything. And I try to, before I have a patient go do a test, like an MRI, is warn them that we could do this test and it can be completely normal, but that doesn't mean you feel well.
Yeah.
And you have to be prepared for that. And it's not, we don't order tests and get yes and no answers very often. There's so many shades of gray when we get a test that people need to be prepared ahead of time, that it may confirm the suspicion, it may answer the question that we have and say yes or no, but it may come back and say, not really sure.
Yeah.
And in addition to that, it may give us other information
That you weren't thinking about.
that we weren't thinking about and has absolutely nothing to do with that, and you have to be prepared to deal with that.
Yeah.
So,
Keeping these points Dr. Radakovich and Dr. Henry have brought up in mind, Cohane et al. Predict many changes to healthcare in the next 100 years, all due to the development in the EMR system. The most notable predicted change referenced in the article is the development of algorithms. Researchers could potentially compile all the data that is being entered into these charts and EMRs and look for trends in treatment outcomes. The article specifically states, complex but empirically validated algorithms will be embedded in EMR systems as decision support tools to assist in everyday patient care.
We did ask Dr. Henry and Dr. Radakovich if they believe there's a disconnect between them and their patients due to technology. Dr. Radakovich said that he didn't believe that the disconnect came between the patient and healthcare provider when they were actually having a appointment, but he believes the disconnect comes when patients ask to be treated over the internet, such as somebody gets a cold one day or thinks they may have the flu or something, and just emails the doctor, hey, can you send me a prescription for this, or I have these symptoms, can you just give me this, or can you give me something for it? He believes that's where the real problem lies, because in medicine you need to see a lot of the conditions, and seeing the symptoms is a big part of it. So he thinks definitely that emailing for prescriptions and other various treatments is the biggest problem. Dr. Henry, on the other hand, said that she did see disconnect within the patient appointment, but that she tries to inform all of her patients, as she's typing, hey, I am still listening to you, I just have to document while you're talking.
When asked what technological advancements have been most beneficial for patient care, Dr. Henry stated she believes the EMR system has been one of the most beneficial technological advances in her patient care. She also stated that the time spent learning how to use the multiple different systems can get tedious. She brings up a good point that it would be much easier for healthcare providers everywhere if there were just one electronic system that all doctors could use. Now, in theory, one universal system sounds great, but there's a great potential for misuse also. In her article, Peggy Eastman quotes Miss Laura Adams, the president and CEO of Rhode Island Quality Institute, saying, the ideal of a very large-scale system in healthcare is innovative, but it also underscores the need for patient privacy and trust among system users. Rosenblum et al. Researched the idea of a nationwide EMR system in Canada in 2011. It was mentioned that the lack of harmonized policy to guide adoption of the nationwide program was seen as a problem, to which it was suggested that the efforts be devoted to regional compatibility before the problem of national compatibility was tackled. This can be compared to the systems we have here in the United States. It would make sense to focus on the lower levels of the organization before the broader areas. Getting a county-wide program first would be a major achievement. Then progressing from there would be a more successful integration plan. In recent years, we have taken digitization and technological advances for granted. When we asked Dr. Radakovich this same question, he remembered practicing before there was access to the internet. In this day and age, we are constantly looking ahead to see what could be better. But most of us don't stop to appreciate what we have now.
Probably, if I had to use a broad brush, I would say just the internet. I mean, or digitalization of information. Because that has it gives more people access to the technology that we have available. It gives people more information. It gives patients more information. It gives the treating providers more information. And as fundamental as it may seem, especially to a person who's grown up with that and not known a world that didn't have that, it's so profoundly changed things that in my opinion, that would be it. I mean, it's almost like the invention of the internal combustion engine. I mean, it's changed things so much, and how everybody does that. It does their daily job. As I was looking up something this morning, that when I came to WSU in 1998 to go do a search in the library, I had to go to 3 different libraries to get the journals that I needed. I can't remember the last time I've been in a library. Being able to do it all from the desk, in the resources that are available, journals and online access to information, not just what's out on the internet, but the same medical information that you've had to physically go get, which I think your generation takes for granted. I certainly don't, because of having had to do it the hard way. I can do a literature search and read through everything pertinent in usually an hour or two, whereas it used to take sometimes a week or more to be able to gather everything, get the journals, get the copies, having spent 4 or 5 hours, and I hadn't even read anything yet.
Lastly, we asked both doctors the final question of, do you think that technology makes your clinic visits easier or harder? Dr. Radakovich said that he kind of believes in both. He believes that it does create a lot more misinformation with his patients, so that they come in with kind of already preconceived notion of what they have based on what WebMD says or Mayo Clinic, whereas maybe it's not quite fitting their case directly. He also said that he does believe that technology is much more beneficial for at-home programs, because he can just send a link to a rehab exercise or a YouTube video to show them how to, dress a wound properly if they were to get stitches, or how to clean it. And he definitely thought that was a big benefit to having technology. The nurse that we asked also did say being able to show test results bedside is a very important piece to help relieve the mind of not only the patient but the families as well. And one thing, we did find an article by Janet Mullen, and I wanted to read a quote from her because I thought it was a very applicable quote. And she says that the goal of a system should be that it makes it easy to do the right thing and hard to do the wrong thing. Basically, this means that, it should, a new program should be really easy and simple to be able to get what you need to done and not kind of give you the headaches along the way. And I think this is a big piece to understand, because a lot of new technologies, as we know, aren't very simple. They're very complex. They're always new. So having to change over technologies as well as continue to learn and use them sometimes can be a little bit of a challenge when you're changing a new medical record system every couple of years, or a patient monitoring system. It always changes, and it's always new, and they're always difficult and confusing.
We conducted a survey online to see if patients feel the same about technology in the medical setting. 28% said they feel unheard and that technology interrupts their doctor's visits, and 48% said they would like more face-to-face time with the doctor in their appointments. In these numbers, it is apparent that the doctors feel more of the impacts of technology in regards to doctor-patient interaction. Based on the information we have gathered from our primary sources and some secondary sources, we believe that digitization has overall had more of a positive impact on medicine. There are many more changes to come, and hopefully they will be targeted at making the negative aspects of technology in medicine better.